You can do it a number of ways. You can telephone the office to refer through our first contact team. You can email office@advanet.org.uk, or you can fill in a referral form on the website. The criteria for an NHS complaint process: if the client is complaining about past treatment and care, so within the last 12 months, they may go through the NHS complaints process. If the concerns haven't been resolved fully by staff or PALs, they would like a written response to their complaint. The treatment and care received happened within the last 12 months, or the client realised within the last 12 months that they are not happy with the treatment and care received in the past. For example, if the client requested their medical records in the past 12 months and then noticed a discrepancy or cause for concern with regards to the treatment received in the past. Health Complaints Advocacy can still support the client if they fall outside of these criteria. For example, they may wish to make a complaint and submit mitigation to explain why they are complaining outside the normal timescales. So the types of advocacy issues that we work with span quite widely. So it's anything to do with your care and treatment with the NHS. So it could be about medication. It could be about that you were mistreated by someone. You didn't have a good experience there. They misdiagnosed you. They got your notes wrong. There's so many things that come under what advocacy can support with, but it's basically anything to do with your care and treatment under the NHS. So the sort of cases we come across as an advocate, again, span quite widely. So it could be that a GP typed up the wrong notes for the wrong patient, and through the complaints process, we supported someone to go through that process and correct that and make sure it never happens again. We have cases where someone may have been given the wrong medication. They may have not been able to get the medication they needed. So the complaint could be about actually getting that medication they were refused of. It could be that you were misdiagnosed with something. So we sometimes may get referrals through to complain about a diagnosis, whether they were given it or whether they weren't. There's a lot of different cases we deal with on a day-to-day basis. So no one case is ever the same. So the sort of challenges we face as a health complaints advocate can come from all angles, and we've always got to find a way to be able to support a client. These issues could be communication issues between the NHS and the client. So coming with better accessibility options for the client to be able to communicate their complaints. Other issues could be that getting in touch with the complainant can be difficult. Other issues we can face is that, especially during COVID, sometimes the complaint process can take substantially longer. So sometimes a complaint can be sat waiting with the PHSO, the Ombudsman, and it could be quite a while until you get a response. So it's just about us trying to keep that communication open, being very clear with what's going on, and having an understanding of what happens next and what we can support you with. But the positive outcomes of doing health complaints advocacy can be seeing that the client's voice is heard, is very empowering. seeing that a client ends up being able to self-advocate for themselves is very empowering. We always love to see people being able to self-advocate, to see that they have been listened to, that the complaint has been listened to and action has been taken. Sometimes there could be policy changes. There's all sorts of outcomes that can come from a health complaint, and to see those happen, it's really nice, and especially when your client has obviously been through a traumatic time, and for that complaint then to turn into something positive is it's worth a million words, really.
The Advonet Group are an independent advocacy charity based in Leeds.